Okay. Can you imagine a situation where your doctor, who has an annual 50-hour mandated development plan, uses patients' needs to identify their particular deficits? Can you imagine that the learning and education that you've identified is being taught and shared by other healthcare colleagues across different silos, and therefore de-siloing? Can you envisage your own skills empowering colleagues? And can you appreciate that your own professional deficiencies can be met by colleagues at easily found events, not just by pharma and not just by agenda-driven companies with marketing budgets? Can you see an ecosystem where everyone equally shares high-quality learning and improvement activities, and where healthcare professionals are connected and are nurturing each other, all the while, most importantly, driving patient safety and care? Can you envisage this? Welcome to UCAN, our web-based app.
So we are UCAN Connect and Network, which is a web app that GPs can use to improve and digitise the personal development profile. Personal development plan process that currently exists, that is all paper-based, and digitise it so that they can find events to attend, connect with other GPs that can help upskill them in areas that they identify a deficit of their skills, and upload and share resources with each other. So our team is made of 4 computer science graduates, 1 health tech founder, and 2 GPs. And it was very important for us to have the GPs on as subject matter experts, which we would call SMEs, as they were able to help us identify a problem that they face day to day. And basically our GPs also have experience as doctoral appraisers, and you identified a problem that the GMC, the General Medical Council, have updated the process for these appraisals that is shifting the focus away from clinical upskilling to these lower 2 domains, which includes colleagues, culture, safety, trust and professionalism. So we have developed a web app where you can upload your existing PDP. It's very low friction. And it will use analysis to pull out your areas of deficit, so then you're able to see events and resources that are tailored towards your particular deficits, as well as it's fed by your PDP and it feeds into your PDP, and it can also lead to greater data generation of where funding needs to go to help these deficits. If we can analyse the deficits of all GPs across the country, it can better direct the funding from private healthcare and from big pharma. So this is our demo. If you can grab a photo of it. Oh, Tim's already got it. So basically, a GP will log in with their HSCNI email address, and it will be verified with her GMC number. And the initial process is to upload their existing PDP, which they already have, that they have to do every year for their appraisal, which Tim is doing. And this will pull out, he's going to upload anything from this computer, sorry to whoever this computer is. Just if you click skip for now, click cancel and click skip for now. It can feed in, so then you can see the events that are relevant towards your particular deficits, resources that other GPs will have uploaded, and you can upload your own resources, and then you can track your own CPD journey. So this will allow you to log however many hours you've done this year, and the number of hours that you need to do every 5 years. And if you go back to the slides, Tim. But we think this app will be great for ensuring that GPs are able to fulfill this change in the GMC framework.
Well done. Have we got any questions, Stephanie? How is it that you that it knows what to recommend to you? So, with respect to your demo specifically.
Well, when you upload your PDP, that will inform what your areas are. So if you do a PDP on a yearly basis, you'll usually have it used to be kind of 2 clinical, 1 organisation.
So is it AI reading it to make the suggestions?
Yeah, so the idea is that we will get AI, most preferably a local model, because this is very lightweight. The PDP is actually just a table with about 4 rows with what you want to improve, and there's some notes on it. So we'll extract that in the JSON data and just feed it in, label them domain 1, domain 2, or on the leadership, I want folks in communications.
But in what you demonstrated today, was it labelled, or how did it generate the recommendation?
There's no generation today.
Okay, thank you.
Great idea. I have many GP friends, and the number of conversations at certain times of the year which are about this is unbelievable.
That's what we're concerned about. Older patients with older GPs with all that knowledge and expertise, and retaining and recruiting those staff and keeping them in place, because any paradigm shift in the GMC results in panic, and it's trying to make sure that we can all support each other. And the irony is, if you lead in and buy into the system, you actually become part of domain 3 and domain 4, because you autonomously become collegiate and you become better at protecting your patients, and it's a self-fulfilling model.
I get that vision, it's wonderful. I'm just going to say, quality assurance of the information. How are you going to ensure that the information that is on there is actually, you know, of sufficient quality to be accepted as training material by the dreaded GMC?
Yeah, so we ensure that you have your kind of registered number. So you have your registered number. This is a platform purely for practitioners. So that's how we kind of do it. When we upload the data for it, people can review it and comment, and it's live sessions. And people are going to be uploading multiple kind of resources, both in kind of video format or in text format. So you can very easily see what is good and what isn't without you having to put your time into it.
Self-correcting science.
So the GMC do not tend to regulate in the way I think that you imagine that they do.
But we don't want to diffuse rubbish.
Yes.
Yes. That's my point.
Yes.
It will be uploaded by GPs. I mean, if I was creating an event, that would have to go through a certain scrutiny. It would have to come from a specific clinician. I mean, you'd be looking for... one of the reasons I want to try and address this is there's so much going on out there, nobody knows anything about it. And as somebody, and I've got conference fatigue twice in 10 years, last week and this week, one of the things that has been really obvious to me is that there's so much generosity out there, and people can't get that information out. And they create these fantastic domains, and there's nowhere to share it and get it to the one place. I want to do cardiology, these people, they see what's going on in the university, the Ulster Medical Society, what's going on here, what's going on there. There's so much stuff out there.